Greetings, everybody. Thanks, and I appreciate you opening the email and giving us a couple minutes to explain kind of all the insanity that's been going on. When Christus came to Santa Fe and we began to develop a relationship with Bruce Tassin, that's when we first started talking about a partnership in cancer. And New Mexico Cancer Care got some great things out of this partnership. We did it for a reason. We got continued management control and direction of the cancer program and the cancer center. We got security. The idea was that the hospital would obviously not have additional cancer providers, and we would be able to take care of all of the patients together. And we also benefited from the hospital's resources. And together we built, I believe, a fantastic program. But New Mexico Cancer Care also gave up some things to have that relationship, and we took some risk. Primarily, we gave up chemotherapy and our infusion room. All of that revenue went to the hospital. Physically, we turned our chemotherapy room into administrative space, additional exam rooms, and a conference center. And together with the hospital, we built an infusion center on the second floor of our building. We also gave up employees. Nurses, medical assistants, and pharmacists had to become hospital employees when they previously were with our group. And we fought really, really hard to make sure years of service transferred over, salary ladders were appropriate, etc. But our long-time employees had to become hospital employees. The last thing that New Mexico Cancer Care gave up was our identity and our branding. We decided to focus on the cancer center rather than our individual identity. And the truth is in this partnership, we were taking more risk and giving up more than the hospital. The hospital moved their radiation center to the building. Our radiation partner went back to Albuquerque, and we remodeled our downstairs area. We got rid of our infusion room, and we knew that we were taking tremendous risk. That is the entire reason that we built certain safeguards into our contract. We anticipated from the beginning that even if this was a successful relationship, medicine changes, the community changes, players change, we may eventually part ways. And we wanted to make sure that we were restored to a fully functional private practice with the same capabilities that we had prior to the relationship. We put that in there. We wanted the opportunity to redeploy clinical staff if they chose to come back to New Mexico Cancer Care. We wanted to make sure that during our contractual relationship, they did not set up a competing oncology clinic and put us in a situation that we were entirely dependent upon them and competing with them at the same time. All of those things are in there, and all of those things have been completely disregarded. And that's how we ended up in this situation today, where our patients are unsure of what's going to happen, we're unsure of what's going to happen, and really the stance has been the hospital's going to do what it wants, and we have to have a legal solution to stop them. We also wanted to begin having a real dialogue about the cost of care in our community. There's no way as a contracted or employed physician you can have direct conversations with payers about value, about cost of care, about any of that. And financial toxicity in cancer care is real. Our patients feel it absolutely every day in the form of copays, insurance premiums, and facility fees. We know as an independent private group, we can reduce the cost of care substantially from day one. we think it's time to have that discussion in this community. So the question is how did we get into the situation where we have a termination date and we're all trying to scramble to figure out how we're going to keep taking care of these patients? We informed Christus Corporate in July of 2021 that we wanted to remain independent and that we had a plan to do so. Our contract had been extended. We knew that we had until January 2023 to make our plans and transition everyone in an orderly fashion. So why all of this panic and nonsense? And the truth is we believe that Christus is trying to snuff out a competitor before we can get started. And we have finally agreed to mediation, and we're hopeful. But I think there's some realism and a little bit of skepticism to the mediation, that they're simply trying to buy more time and grind us into the dirt. The question is for you guys, for our patients and for the community, what can you do about this? How can you help? And we really need your help. At the end of this video, there's going to be an information sheet, and we're going to make it easy for you to download or connect to the links. We really need you to sign our online petition and put your email address in there. Christus is still refusing to give us direct access to our patient contact information. We need to know how to reach you. We're planning a community event in the next several weeks. We would love for you and your loved ones and any friends and anyone that is concerned about medical care in this community to show up. And we'll use this contact information and we'll use our Facebook page to reach you. We need our patients and our community to make as much noise as possible. We need you to contact Ancorum. They're supposed to be the community voice, the community conscience of this hospital. They own 50% of the hospital. Where are they in this discussion? Reach out to the board of directors. Reach out to the Ancorum board of directors. Reach out to the mayor and city councilors. Tell them that we need independent medical groups as part of a thriving medical community. But we simply can't sit by and let them try to grind smaller practices into the dust in order to accomplish their goals. Thanks for giving me a few minutes and listening. We really hope to stay in touch with you all.